This is Doug Field, and welcome back to Healthcare Consumers Radio. I'm joined again by my co-host, Ron Bachman. And we're very excited about this next segment. A lot happening in the wellness category and some very unique individuals and companies doing some very unique things. And joining me and us on this program is Heather Provino, CEO of Provant Health Solutions, which is a health and wellness provider with a clear vision on changing the health in America one person at a time. Heather, welcome. We haven't talked in a while. Welcome back.
Thank you so much.
Yeah, nice to have you here. Tell our audience a little bit about what you're doing at Provant. Kind of update us on what you're doing at Provant Health Solutions.
Absolutely. Provant is rapidly expanding and growing and working with organizations to look at the health of their employees as well as the individuals that their health plans and organizations touch, so extending that to families as well as communities and helping them maintain and or improve their health.
What do you see some of the biggest challenges that your employer clients are dealing with today?
You know, I think from a business strategy perspective, I think the focus is always on the bottom line, and the challenges that our ever complex health care system is presenting to organizations and having to fund a lot of that expense and or decisions on whether or not to share that cost with their associates, and what that looks like from a business strategy perspective in terms of retention, growth, recruitment of talent, etc.
Heather, this is Ron Bachman. Everybody's doing wellness these days. It's a big area, big focus. Employers are doing more and more in these areas. There's lots of vendors out there. What has made your program unique? Why have you grown so rapidly? And, you know, I'm impressed you've been named the 2013 Woman to Watch in Providence Business News. So you're obviously doing some good things and some right things. What makes your program different and unique from the many wellness programs that are out there?
You know, I think that's an excellent question because I think wellness in general, from a programmatic perspective, it all kind of looks the same. You know, we all do assessments, we all do interventional strategies such as coaching or disease management. But I think when you start to take the focus back to the individual and really start looking at the people and their own particular lives and how good health eventually builds wealth for that individual in so many facets. Wealth not just from a financial perspective, but from a quality of life perspective, a happiness perspective, what they're able to enjoy in life. And so I think when you bring it down to such a personal level, you really start to intrigue individuals to start thinking differently about, you know, it may not be affecting me today, but what about a year from now? What about 5 years from now? And what investments do I need to make in myself? And more importantly, how can I do that? And I think we're there to assist people in saying, once you've made that decision, we're here to stand beside you and walk alongside you during that journey.
Talk about how you might approach people differently or together in what I might call the intrinsic value of doing that. I do it because it's the right thing to do. I do it because I've been inspired to do the right things. Versus what many are doing as well, and I think you're also doing it, and that's the extrinsic, that I'm going to provide an incentive. I'm going to provide a reward for doing the right thing. How do you match up those two, and is it different for different employer clients that you have?
It's absolutely different, and I think, you know, just like we have millions of different individuals, we have different employer cultures, and I think you have to assess where along the continuum individuals are. And it's not a bad thing to utilize extrinsic or those rewards to help people develop small successes along the way or mastery of certain competencies that they need to be healthy to spur on that internal motivation for somebody to say, this is the right thing for me and I'm going to keep doing these habit-changing activities. You know, it's hard. Health and wellness, it's just not sexy. We're not out here saying, you know, do this activity and you're going to enjoy this lifestyle. We're asking people to sweat and make really difficult choices and maybe not eat that wonderful dessert. So we really do have to look at everything on that continuum and really try to build within individuals the idea of autonomy. I have the skills to do this, the idea of purpose. What is my purpose for wanting to do this? And then the mastery of the different skills that they need to continue to do that.
On the incentives, how does an employer figure out how much? I mean, to motivate people, to inspire people, to get them to change their behaviors, to be healthier, might be very different from, say, a Microsoft to a General Motors. Let alone within a company, each individual has a different level of motivation and what might encourage them. How do you help an employer figure out what the right level and for the extrinsic, and how do you help them with the messaging for that intrinsic self-motivation?
Sure. I think there's tons of models and studies that have been done about average spend for extrinsic motivators, and we certainly use those as kind of a baseline, but then going in and looking at the employer's culture and understanding what really spurs on employees. You know, we work with one group, and we were amazed at the level of effort that individuals would go through simply to obtain an item with their company's logo on. There was just extreme pride in their organization. And for other groups, that may not motivate anybody, and it may be all about the dollar. Mm-hmm. So you really have to look at the culture and utilize any tools that the organization might have looked at from a retention engagement perspective globally, you know, such as employee surveys, things mm-hmm. like that. Gauge that against the models that are already out there, and then, of course, you know, we have all of our own systems that really look at and model out what's that right value to pull at that heartstring.
Now, a lot of employers in their wellness programs for the rewards and incentives have moved from participation, engagement, completing a course, to health status and outcomes. What's your opinion about the movement in incentives towards more outcomes? Is that what you're doing, and where do you see it going?
We absolutely do encourage that. You know, we're huge proponents of self-responsibility for one's own health. And so by starting at participation-based, that's a great way to invite people to the table for probably the first time to decide whether they want to be a partner with their organization. And they can be one of two partners. They can be a financial partner, or they can be a health partner. And when you start participation-based, you're giving people the opportunity to make that decision and come to the table with a little bit of a lower stake. As you add outcomes, you're upping the ante, but along the way, you're also providing people with all the tools and resources that they need to make changes to meet certain standards. So that really just exemplifies the concept of having your own responsibility for your own health and well-being, and making that decision of, you know, I'm going to help my organization and myself, my own life, from a financial perspective, meaning I don't want to participate, or I'm going to be a health partner, and I'm really going to come to the table and I'm going to try to change the health of America by doing what I need to do and take responsibility for that. So absolutely the progression between participation-based to outcomes-based, highly, highly encouraged.
So who are your major clients? Are they large self-insured employers? Are they insurance companies, small groups? Where's your target market?
You know, we cover the whole gamut. So we have employers as small as 7 lives, and we go all the way up to employers with over 300,000 lives. We also work with carriers as well. We really we're focused more on the comprehensive strategy in terms of how can we help employers come and develop overall strategy for how health and wellness can assist their business in being better at what they do.
So your main marketing is directly to the employer HR benefits area?
Exactly. We work with a lot of benefits comp. Some of the larger groups that we work with do have the luxury of having a health and wellness division, but primarily it's usually housed within the benefits suite.
So tell us how the Affordable Care Act fits into the strategy of wellness, incentives, rewards. How do you see that playing out as we move forward?
Yeah, that's a great topic of debate right now, but certainly with the advent and support of new legislation, we're seeing that, healthy lifestyle programming and incentives are being encouraged. So that's great news for organizations. They've been given the permission to go ahead and have those conversations with their employees and start to say, we need your assistance in this. We can't do it alone. On the flip side, I think there's a lot of regulations to kind of work through, and what does that mean for employers in terms of paying or playing? In making the decision, are we going to stay in the traditional model of offering benefits, or are we going to kind of tell everybody you're on your own? Mm-hmm. And from there, the conversation kind of branches out to, well, then what happens with the wellness component? Right. Do we shift that out to the exchanges? Do we keep that internally? And why would we keep that internally as an organization? So I think those conversations are the ones that are happening now. We did get a little break recently in pushing that off for a little while, so we have some time to continue those conversations.
Very good. Now, before I turn back over to Doug to wrap up, the rewards and incentives that we hear about in the marketplace take various forms. I'm wondering if you found one more successful for an organization than others. Some were putting monies into an HSA account, some were changing the cost-sharing features, some were changing the premium contributions that were made by the employees. Are you finding other approaches, or among those approaches, what are you finding that's the most acceptable, or maybe the hottest area these days?
The number one method that we've seen is tying some sort of eligibility that absolutely gets the highest levels of engagement, but it's the most controversial. Mm-hmm. The most standard is to link it to the benefit design in some way, so either lower premiums or contributions into the HSA, HRA. So we absolutely administer a bulk of those. What we're really starting to find effective is combining that with some instantaneous rewards along the way. Mm-hmm. So keeping people engaged and not just participating in kind of a one-time event per year just to qualify, but then also providing them incentive to stay engaged and really work on behavior change and risk migration.
Well, Heather, listen, I really appreciate you taking time today, and we've got about 2 minutes to go, or about a minute to go, I guess. So I just told my producer here. So if you give our audience a couple clean takeaways and tell them how they can get in touch with you, please.
Sure. So I think the number one item to do is really to sit down and think about your strategy as a whole, and not just have wellness be a one-off. And then from there, really examine the culture and how you can elicit extrinsic motivators to spur on that intrinsic, that internal motivation. So what are your long-term objectives and goals? Design the program to meet those, and use programs and services to support those. I'm happy to talk with anybody about that. Absolutely can visit us on the web at ProvantHealth.com, and we would love to have those conversations with people.
All right, Heather, thank you so much for joining us. And
thank you.
To our audience, stay tuned for the next segment, Healthcare Consumerism Radio.